Welcome to Medical Myths, Legends, and Fairytales. I'm your host, Dr. Alan Christianson. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it. Hey, Dr. C here with you. Welcome back to the Thyroid Beginner Series. This one's going to be about nodules. You may or may not have heard of these, but they're pretty relevant. So thyroid disease is a disease of how the gland works, how the immune system treats the gland, but also of the structure of the gland. And the biggest risk here is thyroid cancer. And this is a big risk. Thyroid cancer is the fastest increasing type of cancer amongst women today. It's a big deal. There was debates as to whether we were just detecting it better or whether there's really more of it. And there's pretty clear consensus that there is more of it. It really is on the increase. And tracking thyroid cancer and screening it has a lot to do with making sense of thyroid nodules. So nodules are lumps of tissue that grow in the thyroid that are just not normal. They're not the right type of cell, not the right cell density, and they don't always respond to the normal signals that control the cell's growth. And they're common. In fact, someone's age, an adult's age in years, is pretty much their percentage risk for having a thyroid nodule. I'm 55 as I record this, so my odds of having a nodule are about 55%, greater than 1 in 2. And the relevance is that if you have one, the risk of it being cancerous or becoming cancerous ranges from about 2 to 7%. So yeah, most nodules are harmless, but a subset of them, which is greater than 0 by a lot, are not harmless. And you wouldn't know about them necessarily. Some people have nodules that are large enough to where they've got a lump that they could feel or that someone else points out to them. There have been a lot of stories about media personalities in which their fans notice a nodule or a growth on their thyroid. But those with thyroid disease, all this applies even more. The odds are higher to have nodules when someone has Hashimoto's or hypothyroidism. And furthermore, there's greater odds then of also having thyroid cancer. So what do you do about this? Well, the minimal step is to do a thyroid self-exam. Most have heard about the idea of breast self-exams and, totally appropriate, but this is the same idea. So a regular habit each month of feeling your thyroid, feeling the tissue around that, and just being aware of any changes that occur. It's a pretty simple procedure. Each month on social media, I do one of these live. So there's always going to be a recording of that at the very end of the month, at the very beginning of the month, and I'll walk you through how to do it. It takes only a few minutes and it's super easy. And I'll remind you next month anyway. So yeah, at Dr. Dr. Alan Christianson, just follow me there on Instagram or Facebook, and I'll be doing those live then. So that's the step that's appropriate for everyone. Next would be a physician's exam. Now, this means you want your doctor to feel of your thyroid. And ideally, this is your thyroid doctor. So ideally, an endocrinologist or a thyroidologist who's a subspecialist. And a doctor's exam is something that can detect abnormalities if they're large enough and if the doctor happens to identify the right spots, but they're not perfect. So there's debates as to whether everyone with thyroid disease should take the next step, which is to get an ultrasound. And most thyroid specialists now do recommend for ultrasounds. Pretty cool. These are not radiation. They're not invasive. There's debates as to whether one could over-detect and people could get treatment that is not necessary. But not clear evidence that is a risk at present. So I do encourage ultrasounds for those with thyroid disease. And there have been just countless examples of people whose lives have been saved because of this. They've reached out and said, yeah, I got an ultrasound and it was found that I had thyroid cancer. Never would have found it otherwise. It was an aggressive type and we caught it early and it was treated. So that happens. Way more common is that either nothing shows up or someone has a nodule or a few nodules. And the drawback is that if they are identified, then you've got to stay on top of them. But now at least you're aware. And in most cases, it's a matter of every so often repeating the ultrasound and seeing if there's been a change in their size. So the question then is, if you do have them, can you do anything about them? Are there any steps you can take that cut their odds of growing or becoming cancerous? And this is great. There's actually really good evidence that there are some safe natural options that can make a big difference for most people. 3 things are relevant here, one of which is regulating iodine. Again, it's not good or bad, but you want healthy amounts. And this is the same discussion as the iodine episode and a lot of the diet discussions. Consuming a big range of healthy foods, but being cautious about those that have really unusual amounts of iodine. That's what this really comes down to. And the paradox is that way too much or way too little can be a problem with nodules. However, in the modern world, way too little is pretty tough because all of our foods have some iodine. So way too much is the bigger risk, especially for those prone to thyroid disease. So that's the first step. Second step is weight loss if appropriate. Now, it seems that nodules have a connection with insulin levels, and insulin ties into body weight. So if someone is above their ideal body weight, they may have higher serum levels of insulin, and that can stimulate the growth of thyroid nodules. So controlling insulin, keeping it to a low range, not only helps raise the odds that nodules will shrink, but it can help lower the odds that they will progress and become cancerous, and really good evidence around that. Now, if someone's at a good body weight and has healthy insulin metabolism, good control of blood sugar, this doesn't apply to them. But, for somewhere around 85% of us in the modern world, it does apply to us. And of course, there's a long list of other reasons why that's an appropriate healthy step. The last one is nutraceuticals. And we've got good evidence that a couple of different nutraceuticals can make a big difference. One study used a combination of spirulina, boswellia, and also curcumin. And they showed that the combination pretty dramatically shrunk nodules for a good percent of people. There were some other studies looking at the effects of inositol and nigella. One looked at the effects of prunella, actually a fair amount of data from China looking at the effects of prunella. And as a generalization, these things have been shown to reduce nodule size by somewhere around 3/4, so they can shrink pretty substantially, and amongst most people. So generally recognized as safe ingredients. As always, if you're on medication or getting medical guidance, talk to your doctor. But these are safe non-prescription ingredients. These are things that we don't know about their safety during pregnancy, so it wouldn't be used during pregnancy. But barring that, good evidence that just with regular use, these are ingredients that can cut the odds of nodules causing problems. So like the other products in the thyroid-specific formulations line, I just looked at these studies and chose the ingredients based on those studies and in the amounts used in the studies and made a product called Nodule Control. So really easy, meant to pair with the Thyroid Daily, and just an easy way to help the odds of nodules not progressing. So simple action steps. If you've not had a thyroid ultrasound and you've got thyroid disease, it's probably a good idea. You may find there are some nodules present. Get into the habit of doing a self-exam on a monthly basis. Just follow me on social media and I'll remind you about that. And take basic steps that can help. You can go a long ways towards cutting your odds of these nodules causing future problems. All right, Dr. C with you. Take great care. We'll talk soon in the next episode. Bye-bye. Hey, Dr. Christianson here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christianson on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much. I'll be back with you real soon. Bye-bye.